The purpose of this video is to explain the benefits of breastfeeding and to encourage mothers to do so. This video is more of a why to do it video instead of a how to do it video. In spite of the many health benefits of breastfeeding, surveys show that 30% of mothers never attempt to breastfeed their baby, and only 1/3 will breastfeed until their baby is 6 months old. The World Health Organization recommends breastfeeding for up to 2 years or beyond, and exclusive breastfeeding for the first 6 months of life. The American Academy of Pediatrics recommends at least 1 year of breastfeeding and exclusive breastfeeding for the first 6 months of the infant's life. Exclusive breastfeeding for the first 6 months of life provides continuing protection against diarrhea and respiratory tract infection that is more common in babies fed formula. The World Health Organization and the American Academy of Pediatrics both stress the value of breastfeeding for mothers and children. The organizational endorsements are as follows. World Health Organization: the vast majority of mothers can and should breastfeed, just as the vast majority of infants can and should be breastfed. Only under exceptional circumstances can a mother's milk be considered as unsuitable for her infant. American Academy of Pediatrics: extensive research, especially in recent years, documents diverse and compelling advantages to infants, mothers, families, and society from breastfeeding and the use of human milk for infant feeding. These include health, nutritional, immunologic, developmental, psychological, social, economic, and environmental benefits. The American Academy of Pediatrics recommends at least 1 year of breastfeeding and exclusive breastfeeding for the first 6 months of life. The benefits of breastfeeding include: first, superior nutrition. Breast milk contains the quantity and the ideal ratio of the baby's required nutrients. Thus, breastfeeding reduces negative developmental issues. One example is that breastfed babies demonstrate a 3 to 7 point higher IQ than formula-fed babies, and this is irrespective of other factors such as socioeconomic status. Greater immune health. During breastfeeding, not only nutrients but antibodies pass to the baby. Thus, illnesses are fewer and sickness is less among breastfed babies. The relative risk of infant illness from formula feeding versus breastfeeding is large, as shown in this table from the American Academy of Family Physicians. Long-term health benefits. Breastfeeding has been proven to lower the risk of asthma and provide improved protection for babies against respiratory and intestinal infections. Infants exclusively breastfed have less chance of developing diabetes and less chance of childhood and adult obesity. Despite being a natural human activity, breastfeeding difficulties are the rule rather than the exception. Putting the baby to the breast as soon as possible after birth helps to avoid many difficulties. The first 2 weeks after childbirth are the most difficult. New mothers should seek the counsel of a lactation specialist prior to leaving the hospital. As the baby grows, feedings become less frequent and breastfeeding becomes easier. New mothers are encouraged to take a resolute, "I'm going to do it no matter what" posture and power through the very tough first couple of months. After the first 2 months, the process is remarkably easier and the benefits well outweigh the negatives. As feedings create grogginess in the infant, feeding times can be used to affect sleeping times. Much legislation aids the breastfeeding cause. 40 states have laws with language specifically allowing women to breastfeed in any public or private location. Employer discrimination on the basis of pregnancy and childbirth is unlawful under the Civil Rights Act of 1964. Per the Family Medical Leave Act, most employers are required to grant maternity leave. I wish you luck, and I encourage you to study the benefits further.